All right, Robert, thank you. The COVID-19 vaccine is scheduled to arrive in Kern County today with nearly 6,000 doses being distributed locally. The health department tells us they'll receive the first shipment before distributing them to nearly a dozen local hospitals. The majority will be going to Kern Medical, Memorial, and Adventist Health Bakersfield. The vaccine will be given to frontline workers initially. And joining us this morning to talk more about the distribution of the COVID vaccine and what it means moving forward is Dr. Jonathan Dario from Adventist Health Bakersfield. Dr. Dario, thank you for being here this morning.
Thanks for having me.
Can you just begin by telling us the process initially on how that you will be giving this dosage to your healthcare workers?
So we're basically setting up the processes to give the vaccines safely, efficiently to all the healthcare workers at our facility. Of course, it's going to go directly to the healthcare workers who are most at risk first. Try to prioritize that, but it'll be available to as many as we have available to our healthcare workers at the hospital. Of course, it's the focus, the priorities go to like ICU physicians, hospital physicians like myself, nursing staff, environmental workers, all healthcare providers throughout the hospital.
We were getting a word about a survey that was going around regarding people that took part in the trials and whether or not they would be available or wanted to take the first dose, the first initial dosage here. Have you heard much about that and what the breakdown was?
I think it was a mix because, of course, there's some people they kind of want to see how the side effects go. There, of course, it's something that's new. It's scary to a lot of people, but it's definitely something that can help. So there are definitely people out there who still want to see what happens, but I think it's still something that a lot of us are choosing to get. To protect ourselves, protect our hospital, our community, so that we can continue taking care of our patients without risking our lives or risking theirs while we're taking care of them. So.
You know, we have only heard of those two instances in the UK where two people had an allergic reaction, but they were already highly allergic. Have you heard of any other reactions to this vaccine, or has it primarily been, I hate to use the word smooth as far as the distribution goes, and side effects? Have you heard of anything else?
No, those were the only two that that have been reported. You could have reactions everywhere. Every time you get a vaccine, you can have a reaction, and that goes across the board. There's always going to be some low risk of those things happening, but it's a very tiny risk. And overall, like they said, those two people who had it, they actually have a history of reactions. They have some risk factors that make it so that they could have a reaction when they get a vaccine. Okay. The general population, very safe.
Now, you talked about your frontline healthcare workers being the first ones in line for this. After that, then where do we go?
Frontline workers first. Of course, they'll work its way through. Try to work its way as much through with the medical staff, healthcare providers, and then one of the things that CDC was recommending was skilled nursing facilities. So the reasoning for that, because they're the hot spots for breakouts of coronavirus infections. When one gets sick, it spreads quickly through facilities, although they've tried to take measures to prevent this. But it's definitely a step forward to prevent skilled nursing facilities from having those big outbreaks.
And once we get through that, there has been talk about different businesses like CVS and some of the larger pharmacy chains that will be distributing this. Will you be distributing it then on an availability to the general population at some point? Will that be through Adventist Health or through other organizations?
I'm pretty sure that's going to be through other organizations. I think organizations across the country, be it CVS, the healthcare organizations, hospitals, facilities like that, are all trying to work out and plan how they're going to distribute it to the public going forward.
Dr. Jonathan Dario with Adventist Health Bakersfield, appreciate your time this morning and best of luck moving forward.
Thank you.